Good afternoon, everybody. My name is Lieutenant Houston Hutchison. I work for Peachtree City Fire Rescue. Today, I'm going to be proposing a peer support mental health and wellness program for Peachtree City. We'll go over what that program consists of and how it will be beneficial for the department. So, Peachtree City Fire Rescue is built around service, professionalism, and taking care of the community. As fire and EMS providers, we're trained to handle emergencies, support citizens during their worst moments, and continue moving forward after difficult calls. This proposal focuses on taking that same level of care and applying it internally. A peer support and mental health and wellness program will give PCFR personnel a structured, confidential, and trusted way to seek support, process difficult calls, and access resources before stress becomes a crisis. So the problem facing fire and EMS providers today, we're repeatedly exposed to traumatic calls, long shifts, sleep disruption, very high expectations, and cumulative stress. All these things build up. Over time, these factors can affect mental health, morale, performance, family life, and retention in the department. Some common concerns we have are burnout, critical incident stress, anxiety and depression, PTSD, sleep disruption. There's also substance misuse, and we have a stigma on fear of judgment for asking for help. So we do have some evidence supporting the need. The literature supports the need for organized mental health support in EMS. One of the sources discussed the implementation of a mental health task force in an EMS organization and showed that a structured approach can help create awareness, reduce stigma, and connect members with support. Another source also identified psychological challenges among EMS providers, especially during high stress and disaster-related responses. This review supports the need for education, early recognition, peer support, and access to the professional resources. My main takeaways from the literature after doing some research: EMS providers repeatedly face psychological stress more than most civilians. Mental health support should be proactive, not reactive. Peer support can reduce barriers to seeking help. A task force helps organize and sustain the program. And leadership support is critical for trust and participation. So we definitely need you guys on board as well. So the purpose of this program is to make mental health and wellness a normal part of our operation. This program is not about labeling employees as weak or unable to do the job, but it's about recognizing that repeated exposure to stress affects people, and we're all human. Strong organizations create systems to support their employees, and I believe we can be that strong organization. So we want to support personnel before they reach a crisis point, reduce stigma around asking for help, create a trusted peer support pathway, improve awareness of stress injuries, connect employees with professional resources when needed, and we're going to strengthen our culture by taking care of our employees. The main goal is to create a practical and sustainable wellness program that supports our personnel while fitting the culture of the department. Our main goals are to establish a peer support team, create a mental health and wellness committee, provide annual mental health awareness training, improve access to confidential support resources, provide post-critical incident check-ins, improve morale and employee wellness, reduce stigma around mental health, and evaluate the program after implementation. I believe after implementing it, we're going to improve morale and employee wellness, and that automatically is going to reduce the stigma around asking for help. So our target population would be all of our personnel who are exposed to emergency response, high stress incidences and the daily demands of public safety. So that'd be our firefighter EMTs, paramedics, company officers, battalion chiefs, new employees, FTOs, and any personnel involved in a critical incident. We could also expand this to include administrative staff or dispatch if it's needed. Everybody might not need our support directly, but if you are involved in a critical incident or you need the peer support team for incidents going on at home, that can be expanded to help there. So program planning, the first step will be creating a small mental health and wellness committee. This group would help guide the program, identify department needs, select peer support members, and assist with policy development. One of the sources explains that program planning and evaluation should consider resources, activities, target population, outcomes, and outside factors that may affect implementation. For us, this means the program should be planned around actual department needs instead of simply copying another agency's model. Our priorities would include identify current wellness resources, determine our training needs, select peer support team members, and develop confidentiality guidelines. I believe we'd have some SOPs in place for that. We're also going to create referral pathways, establish evaluation measures, and we're going to gain your support before we launch it, hopefully. So the program will be built around three main components. Peer support, trained members of our department would be available as a first point of contact for any employee who needs support. Education, annual training would help employees recognize burnout, stress, depression, anxiety, PTSD symptoms, and suicide warning signs. And then referral, peer support members will be able to connect employees with professional resources when the situation is beyond our support. This just keeps the program simple, realistic, and sustainable. So our peer support team would be trusted members from different shifts, ranks, and backgrounds. These members should be approachable, respected, and willing to maintain confidentiality. I believe the best way to elect these members are to have a nomination form that people can submit to upper staff and whoever gets a vote or the most votes is able to attend the peer support team training. These members will be trained to listen without judgment, recognize warning signs, maintain confidentiality, support members after difficult calls, provide resource information, encourage professional help when needed, and understand the limits of peer support. And one of the sources we found also states how important peer support is for firefighters and paramedics. So our training needs, our training department is going to be one of the most important parts of this program. Peer support members need more in-depth training, while all employees should receive basic mental health awareness, education. Anybody who's a part of the peer support team is going to dive a little further into that training. The training is going to include active listening, suicide awareness, confidentiality, burnout and stress reactions, PTSD awareness, substance misuse awareness, critical incident stress, referral procedures, and when to involve professional help, stuff we already went over. Department-wide training should include recognizing stress in yourself and others, reducing the stigma, knowing how to access support, and understanding the purpose of our program. So the financial impact, it should be reasonable compared to the cost of turnover, sick leave from burnout, and loss of experienced personnel. You know, what we put into this program, we'll get out of it by retaining those personnel that don't leave. Some possible costs. Obviously, the training is going to come at a cost. Printed materials, outside instructors if we choose to use them. Wellness resource materials and program promotion is some expected costs. Some resources that we can use are existing EAP services, local mental health professionals, public safety peer support organizations that are already established. We can go to them and, gather ideas but not copy their organization's their department. Department training time, grant funding, and community partnerships are also some resources we could use. So the program could be implemented into phases to make it manageable. Phase 1 is going to be planning and approval. So we're going to gain approval from command staff. We're going to create the Mental Health and Wellness Committee to get us started. We're going to identify our current department resources that we just went over, select possible peer support team members, and develop confidentiality and referral guidelines. We're going to make SOPs and implement those before we have the program going. Training and program launch. Obviously, we want to train our peer support team members before we launch the program. We're going to provide department-wide mental health awareness training, introduce the program to all of our personnel. All of our resources, we're going to share them through email, QR codes, station postings, and we're going to begin peer support availability. And then after a year, we're going to evaluate and improve the program. We're going to collect anonymous feedback, review training and participation. We're going to identify barriers such as trust, confidentiality concerns, or staffing. We're going to adjust the program based on the findings, and we're going to present the findings after the first year to our personnel and show them whether the program is working or not. So our strategy, we would use both process and outcome evaluation. A process evaluation would look at whether the program was implemented as planned. This includes whether the committee was created, peer support members were trained, employees received education, and resources were made available. So basically, if we got the program going, and then an outcome evaluation would look at whether the program made a difference. We would use that feedback from the employees to make a report on whether we have better awareness, reduced stigma, improved access to resources, and increased comfort seeking report. One of our sources emphasizes that evaluations should connect program activities to measurable outcomes, and that's obvious. We want to make sure that our program is making strides forward instead of backwards or not moving at all. Data and performance measures. The evaluation will use both quantitative and qualitative data. The quantitative data will be the number of peer support members trained, the number of employees receiving the training, pre- and post-training survey results, number of resource contacts or referrals, EAP utilization trends, and sick leave and turnover trends. We want to gauge whether people are taking more mental health days or less. And then the qualitative data is going to be based on anonymous employee feedback, peer support team feedback, common concerns reported by our personnel, barriers to participation, and suggestions for improvement. So our expected findings after evaluating the program, the employees may support the idea, but they may hesitate to use it at first. It can be kind of challenging and hard to approach a peer support team member at first, but we've got to make it to where these people are approachable and that our employees know that everything's going to be confidential. That's going to be one of the biggest concerns. Continued leadership support will be important, and repeated training and promotion will be needed. The program may reveal gaps in current wellness resources as well. So why this matters? Our people are the most valuable resource. Apparatus, equipment, protocols, and training, they're all there, but none of it will work without the people. A peer support and mental health wellness program would help protect employees who protect the community. It would also show that the department values long-term wellness, leadership, retention, and family life outside of work. This program is personal because every firefighter and paramedic knows someone who has struggled, burnt out, shut down, or carried more than they admitted. So just as a summary and my recommendation for approval, I recommend and hope that Peachtree City Fire Rescue approves the creation of our peer support and mental health and wellness program as a 1-year pilot program. Approval would include creating a wellness committee, selecting peer support team members, providing peer support training, providing department-wide awareness training, and developing confidentiality and referral guidelines. Also, we're going to evaluate the program after the first year. Obviously, to improve it or get rid of it. If it's not working and we need to erase it all and start over, then that's what we got to do. But we're definitely going to evaluate to make the process even better. Thank you for attending this training with me. These are the references I've used to find this information. I hope you all found this information enjoyable, and I hope we can implement this program into our department. Have a good day.